Cassim. We're now going to begin rounds of questions with the Conservatives. Ms. Kramp-Neuman for 6 minutes, please.
Perfect, thank you. I'd like to, first of all, thank you, Chair, and thank all the witnesses that have agreed and so willingly volunteered their time and their expertise to contribute to today's discussions and the democracy of Canada. I'd like to start by directing my questions towards our witness, Dr. Pichora from Kingston. Before I get into the specific question, perhaps I'd like to allow me a few minutes to highlight that under his leadership, Kingston Health Sciences Centre has successfully brought together two of Canada's oldest operating hospitals. And Dr. Pichora serves, as he mentioned, as President, CEO of Kingston Health Services, an academic tertiary care centre serving people all across Ontario. He's a respected orthopedic surgeon, CEO and professor, a true pioneer in his field. So congratulations and thank you for all of your work you have done, Dr. Pichora. My first question today, could you perhaps speak to the complexity and the costs of hospital services? The physician shortage is most acutely appreciated in rural areas of our country, like my home riding of Hastings, Lennox, and Addington. The need for highly specialized individuals, it's never been higher. And further, if you could possibly elaborate on speaking to the interconnectedness of our healthcare system, along with mutual dependencies of hospitals and that of community services.
Well, thank you. I'll try to address your questions. Hospitals are very complex and highly integrated organisms, I would say. It's amazing the extent of just-in-time work we do with teams pulling together. Some of our surgical procedures would be just one example of what it takes to deliver this with highly specialized physicians, nurses, technicians who support various life support systems, etc. And we're the most expensive part of the healthcare system, so it's a valuable resource that we can't afford to waste any of it. We try to be very good stewards of the resources we receive, and having people is at the center of all of this. Everything we do requires people, and so having a robust and appropriately skilled healthcare workforce is critical, and so this is essential to our role in the system. And we don't just look inward. You talked about rural and remote neighborhoods, and although we're also the community hospital for the Kingston region, like many hospitals would be, but we provide extended services to a wide range, including dialysis services in your community. We have satellite dialysis centers in the Moose Factory General Hospital at Winnebago on James Bay, and that's just one example of the complex networks. Cancer care is another one. It's a very distributed system, and although we may be the hub for a lot of these activities, and the place where the most complex required care comes, we support services throughout the region. I think one really good example of this would be the Ontario Stroke Network, which has become a highly effective and life-changing network for patients that in the past had a very dismal prognosis in many cases. And now, because of rapid diagnosis, rapid transportation, and rapid intervention, we're able to reverse the life-changing effects of strokes and really give people a much brighter outlook. So that's kind of an example of the complexity and the expense of running a healthcare system and the role of hospitals. In terms of interconnectedness, most hospitals are experiencing gridlock at the moment. We certainly are. And this is because of increased inflow pressures to our emergency department with patients that are highly complex and critically ill, and then outflow pressures related to home and community care and long-term care, just two examples. And so, we've heard people talk about the HHR challenges of other sectors of the healthcare system, and that is having a big effect on hospitals too. So we can't just focus on one element in isolation, and we have to have a system-wide look at this. Thank you.
Excellent. Thank you.
it if you want it, Ms. Kramp-Neuman.
So perhaps I'll continue on. We have 1 minute left, Dr. Pichora. So perhaps, and if you could speak directly to, we have shortages. We have there's a lot of fatigue. Our healthcare system was tired before the pandemic, and perhaps it certainly, well, not perhaps, it has been highlighted now by the pandemic. How do you see, there's no quick fix. You're not a magician, but a way out of this? Is there one or two key points that you could speak to that you see?
Well, you're right. There is no quick fix. But, you know, right now, the thing that's impeding our ability to restore care most significantly is our rising ALC rates. The patients who've completed their journey of care in the hospital and they're waiting to go to another destination, whether that's home and community care, rehabilitation, or long-term care. And that would make the biggest difference in the short term to us, is to try to implement remedies that will boost capacity in the community so that a hospital can do what it's supposed to do.
Thank you, Dr.
Fantastic.
Pichora.
Thank you.
Thank you, Ms. Kramp-Neuman. Next, Mr. Van Couverden, please, for 6 minutes.